is impetigo? Impetigo is an infection of the skin caused by a bacteria. It is most common in young children, but it can happen to the adult as well. Doctors use antibiotics to treat the impetigo, and they do this by giving the personalized medicine. Antibiotics can also help to keep other people from getting sick as well. Impetigo is more common in the children than the adults, but the adults may also have the infection. Impetigo is made worse by the poor hygiene and warm temperatures.
Of impetigo is a reddish sore clustered around the nose and lips. These sores can be as small as just a dot and can be clustered a lot and is quite noticeable. These sores will quickly turn into blisters that ooze and will burst like a pimple. These blisters will then form a yellow crust. The clusters may expand to cover more of the face if left untreated and exposed to dirt. The sores can be itchy and occasionally painful. After the crust fades, they form red marks that fade without leaving scars. Impetigo can be uncomfortable. Itching and soreness are generally mild. Occasionally, it may involve swollen glands in the area of the outbreak or a fever.
More than 162 million of children from low to middle income countries has been affected by impetigo globally. The highest rate of impetigo cases are in the countries with low resources, mainly widespread in the Oceania. The effect of low socio-economic, lower altitudes and tropical climate are contributing to high rates. Children 2 to 5 years old are most commonly affected by impetigo. Not only that, injuries and infections that breaks the skin also could increase the possibility of someone the risk of impetigo.
Pathogenesis of impetigo. Intact skin usually resistant to colonization or infection by pathogenic bacteria such as Staphylococcus and Streptococcus. Disruption of integrity is to facilitate bacterially colonization and infection. A few common mechanisms of skin include scratching, insect bite, varicella, herpes, viral infection, thermal burn, trauma, pediculosis, and scabies. Staphylococcus and Streptococcus contains a special molecule in their plasma membrane called acetic acid. In order to colonization or infection, this molecule should bind to the other epithelial cell receptor, such as fibroblast A, on the host cell. These receptors are not available to bind on the intact skin, but any kind of skin disruption may expose this receptor and make the bacteria grow.
Impetigo can be treated with antibiotics. A healthcare provider can diagnose impetigo based on how the source looks. The provider may take a skin sample to send to a laboratory. Pathologists can figure out which bacteria is causing the disease, which can help determine the right antibiotic to use. Impetigo is treated with antibiotics that are either rubbed onto the source, topical antibiotics, or taken by mouth, oral antibiotics. A doctor might recommend a topical ointment such as mupirocin or retapamulin for only a few sores. Oral antibiotics can be used when there are more sores.